So this lesson is going to be on risk management, but in reality what this is going to be primarily is going to be about some of the legal principles that you need to know as an athletic trainer, and really understanding what you're obligated to do as a professional. And so we'll start off by describing the terms liability and negligence. And liability is simply the quality or state of being legally obligated or accountable. So oftentimes we use the term liability incorrectly to describe that you're liable for something, as in like you messed up. But that just means that you were obligated or accountable. That just means you're legally responsible for a situation. That doesn't necessarily mean that the situation was improperly handled. That's what negligence is. And in medicine and athletic training, we're looking specifically at a failure to provide the standard of care. And so when we think of standard of care, you're going to be thinking of what a normal athletic trainer would do in that situation. And this is why we spend a lot of time in the interim going over position statements, getting ready for your BOC exam, understanding that those position statements are often the guiding principle for what a standard athletic trainer would do, and failure to follow those position statements would be considered an act of negligence. In order for negligence to occur legally with this, you have to have 4 different components, and all of these have to be present in order for a practitioner to be found negligent and thereby be forced to pay damages. And there are, examples of negligence in athletic trainers being sued and losing because of improper care to student athletes or to their patients. Plaintiff and defendant, I think you know that, but just a reminder there as well. So of the 4 things, the first 2 go hand in hand. And first, there has to be a duty. And what that means is, like the athletic trainer has to be liable for the situation, right? They have to have this legal obligation. And so, this can be a gray area in a lot of things, but most of the time, by getting paid and, and even by promoting or sponsoring activities, the athletic trainer and the host institution have a duty to provide health care and acceptable safe practice standards to their athletes and to their patients. The second part then comes, there has to be a breach of that duty. So somehow that duty has to have not been fulfilled. That can either be one of 2 ways, either an act of commission or an act of omission. Commission, think of committing something, it's something you actually do. Omission, think of omitting something you don't do. So an act of commission is when you do something you should not have, or what you do was improperly done. Whereas omission would be not doing something that you should have done. So in this situation where you see here, there's obviously a duty of the athletic trainer to provide care for this student athlete. If they were to just walk away, that would be an act of omission. And at the same note, if they were to improperly take care and not follow concussion or spine injury protocols with this athlete, and they were to do something, just go there and help them up, different aspects like that, that would be an act of commission, where they're actually breaching their duty by doing something they shouldn't have. In this picture here, you can see a situation that has occurred more often as you would think. And this is an act of omission. it's important that the athletic trainer, one of the things that they say they do is to prevent injuries through monitoring the playing surface. And so you can see here, the mud and the standing water and the holes. And so it could be argued that if an athletic trainer would not stop participation in a situation like this, they would be liable, or they are liable for creating a safe environment, and if they failed to restrict participation in this unsafe environment, then they would be negligent and have breached their duty to provide that safe environment. And there have been examples of this and real things. If you remember back a few years now, for the Miami Dolphins, there was the Richie Incognito, Jonathan Martin scandal, where Richie Incognito was bullying Jonathan Martin, and both the coach and the athletic trainer were fired in that situation, and there was lawsuits brought for negligence in a breach of duty to provide a safe environment for Jonathan Martin because they did not stop the abuse from occurring. But the gray area comes where training and your job don't necessarily align. So just because you have training does not make you obligated or does not give you a duty to help in all situations. But once you do accept that duty, then you can be found negligent for anything you do or omit doing. So if you're driving by and you see a car accident, you do not have a duty in that situation to provide help. But if you do provide help, then you've accepted that duty, and now you can be found negligent for any breach of that duty. The last two things are cause and harm, and these go together as well. So we'll start at the last one, harm. There actually has to be damage that occurs, right? Near misses do not count for negligence. Something bad actually has to occur for negligence to be found. And from there, the breach of duty, right, as we talked previously about, has to be the cause of the harm. And there's this idea of proximal cause. If you remove the breach of duty, does that substantially alter the fact pattern or the sequence of events? And so you can see in this goofy illustration here, this idea of causes being there, and really the cause is going to be up to the judge to determine. But the idea here is, if you were to remove the breach of duty, does that still occur? So you're not negligent just because something bad occurred. Your breach of duty has to be the cause of the accident or of making the accident worse. Standard of care, I mentioned that briefly before, but this is where negligence comes into play as well. You do not need to be perfect with things to occur. You simply need to have acted in a standard way. And so oftentimes in these big cases, other athletic trainers or experts in that area, often authors of the position statements, are called in as expert witnesses to describe what normally would have occurred. And so this is where you really need to pay attention to those position statements and be practicing within that normal standard of care. As far as defenses against negligence, this is how you can manage the risk. The best way is obviously the informal defense, and that is to practice in a professional, competent manner, but at the same point, make sure you're practicing in a patient-centered focus, so that way your patients are at the center of your practice and you're keeping them involved and you have a relationship with them. You can see here that, doctors are often sued or not sued based on how well they are liked. And so the idea that if you are putting your athletes your athlete at the center of your practice, then you are mitigating your risk for negligence, and you're decreasing your liability concerns just based off of the fact that you are perceived to be doing the best that you can. There are a few legal things that need to be considered in there as far as defenses of negligence, but really these are just risk management strategies or best practices for providing the requirements for your patients so that they are involved in these decisions. And the first one is the assumption of risk. And so this is the idea that people have a right to assume specific risks, and they do assume risks when they participate in activities. The important component with this is this failure to warn doctrine. No athlete or patient can assume any risk that they are not warned about. You cannot assume that patients or athletes know the risks associated with their participation in a given sport or in a specific treatment. And so one of the things that is important, and we will discuss more when we get into policies and procedures, are how to document this assumption of risk and education that occurs, so that way the athlete knows the risks they are assuming for participation and can decide beforehand whether or not they wish to participate or not. This also goes with all treatments, and that's where the doctrine of informed consent comes into play. And we talked a lot in treatment techniques about informed consent and how we need to not only explain our treatments, but also the risks associated with those treatments, so that way the athlete or patient has the ability to decide for themselves whether or not they would like to receive that treatment. Some more legal principles to discuss that really don't have to do with mitigating risk, but just have to do with the aspect of negligence. The first one is contributory negligence. This is somewhat of an outdated defense and is not allowed as much anymore, because the idea here is that if the plaintiff is at all responsible for contributing to the injury that they suffered or to the situation, then they are not, or then the defendant is not liable for any financial awards. And so this really is just blaming the other sort of defense. But because the situation is so dire for some, comparative negligence has become more of a situation. These are complex situations that often occur. And so there may be a situation that was made worse by a breach in duty. And so the defendant is liable for some of that. But the idea is if the plaintiff is also responsible for some, then they would also be responsible for some of the costs. And so this is a percentage sort of thing where it's like who's responsible at what percentage, and they will bear that percentage of the costs. Another defense is governmental or sovereign immunity. In certain situations, if the athletic trainer is employed by, say a school district, then that's in fact a governmental office. And so it would be like the government suing itself, and that's how it works with these aspects. And so it doesn't make sense and it doesn't really work out. And so there's this idea that you can't sue the government. But in reality, this really has been eroded with time, and oftentimes athletic trainers in those situations are not exempt from any negligence, especially in areas of substantial breaches of duty. And then obviously, practicing risk management, the best way is to avoid it, and you avoid risk by planning ahead of time for how things can be done and what the most appropriate situation is. And so if risk management has to do with breaches of duty from a deviation from the standard of care, creating policies and procedures and plans that show or that create the standard of care and are followed are a great way to reduce your risk management, because you've already thought about what you should do in these situations, and then you just follow those situations or follow those plans and procedures. However, failure to follow those plans and procedures would obviously constitute a breach of duty from deviating from the standard of care. So emergency action plans, we'll talk again more about this later with that, but you need to have pre-established sets of procedures to be followed if there is a serious injury for each venue, and there's resources available for that. And then your policies and procedures manual reduces the risks by creating situations and procedures that are to be followed that represent good quality care and will eliminate some possibility for people to make their own decisions and possibly deviate from that standard of care. Couple of special issues as we finish up with this: drug testing and risk of liability. Drug testing is incredibly complicated because based off of the legal aspect of this is actually a search of the individual. And so there are all sorts of legal ramifications, including the 14th Amendment of the Constitution with this undue burden without due process. And so with this, anytime you're involved in a drug testing program, it should be seen as educational in nature and not designed to catch people and have the athletic trainer be the cop in that situation. And then wrapping up this idea of risk management with certification and licensure and the difference of these. Not really a better place to talk about them, so talk about it here. The biggest thing is understanding the difference between these two. Certification is the way that somebody demonstrates that they've met the minimum criteria of competency, whereas licensure is a governmental agency policing or regulating a profession or an individual in that geographic region, particularly a state. So certification is by the BOC, and that's a national exam, and that means that you've demonstrated that level of compliance. Whereas licensure now means that you are subject to the oversight of that governmental organization. Most of the times these are state boards of medicine, so in each state that you practice in, you would need to be licensed and go through their process. And that could be more restrictive than certification as far as requirements in there. And so there are two different types of licensure that you need to be aware of. The first is the Practice Act, and this regulates what you can actually do within the profession. And so this is where where the State Board of Medicine usually has described what an athletic trainer can and cannot do. And obviously, going outside of your Practice Act or your qualifications would be an act of commission by breaching your duty to stay within your scope of practice and your skill set. A Title Act just regulates who can call themselves an athletic trainer. And so if you are in violation of any type of licensure requirements, you'd actually be doing illegal activity, and your liability insurance would be void. Lastly, to wrap up, the important thing to always remember is that you cannot practice defensive medicine from the standpoint of eliminating all risk for negligence. Anytime you do anything, there's the possibility of something going wrong. That's why you need to have situations where you've defined the standard of care, as well as educate your patient about what you are doing, and so they assume some of those risks and know what those risks are. A couple of other aspects to keep in mind is most of the time lawsuits are brought because the cost of medical care can become so overwhelming that there seems to be no other way to manage it than to try to get some help by suing the athletic trainer and the institution employing the athletic trainer. And so if you have the ability to advocate for athletic accident insurance or at least catastrophic injury policies, that will decrease your risk of liability greatly because people will have other ways to get their medical bills paid. Most of the time, people are not suing in order to try to punish the person that messed up. They're just trying to get their medical bills covered. So if you can advocate for your institution to have athletic insurance and catastrophic injury insurance, it will not only improve your ability to provide care for your patients, but also decrease the liability risk for your institution. And so that's it for the description of risk management and some of the basic legal principles of negligence. If you have any questions, as always, please let me know. Thanks.